In this presentation, we're going to talk about complications of healing and tissue repair. This is going to involve things like impaired wound healing. And again, this can happen at any point in the process of wound healing. And we want to remember the factors that impact wound healing. These include things like ineffective inflammatory response, inadequate immune response, not getting the right nutrition, and poor tissue perfusion. So we can end up having issues or complications of wound healing like infection, ulceration, dehiscence, evisceration, development of keloids, or development of adhesions. Infection, when we destroy that first line of defense, it makes us more vulnerable to infection. So we have a break or a cut or an injury anywhere, we're going to be more vulnerable to getting an infection. And that's going to be impacted or made worse by things like poor inflammatory and immune responses, or anything that impairs wound healing. And we're going to cover that infection response later on this semester. I don't believe it's in Module 3, so just disregard that. So infection can also cause other complications of wound healing. For example, when infection behind a surgical wound causes a buildup of pus and pressure, it can actually cause that wound, that incision that we sewed up, to pop open. That is going to delay the wound healing for sure. That's not going to help them at all. Evisceration is where this happens in somebody that has had surgery in their abdomen. So we sewed up, we cut everything open, did something in their like intestinal tract or something like that. And then we sew up the muscle and then we sew up the skin, right? Well, one of the things that can happen is that they either have an infection behind there that's building up pressure, or they could have like constipation and they're bearing down, or they can be coughing really hard because they have pneumonia or something like that. That puts a lot of pressure behind that incision and it causes it to pop open, not just at the skin, but also at the muscle. And it's bad enough that it causes the intestines to be exposed on the outside of the body. That is a medical emergency. Those intestines have to stay moist. They need to be inside. And when they're outside, they will die very, very quickly. So we cover them with saline-soaked dressings, and we get that person down to the emergency room and to the surgical suite so that it can be sewed back up. Infection can also increase the risk of scarring because it delays and complicates the healing process. Now, we talked about the healing process of pressure ulcers in the previous presentation, so we're talking about some of the complications here. Again, ulcers or pressure sores are also known as decubitus ulcers, pressure wounds, pressure sores, and they happen because somebody has had ischemia. They have a lack of perfusion that didn't allow oxygen and nutrients to get to a specific site in their body. And with that, it actually causes a breakdown of the tissue. So an ulcer is a round area. It's usually open and very crater-like, meaning it's, deep-ish, depending on the stage of it. And it causes a break in the skin and the mucous membranes. There are oftentimes areas of necrosis, which makes them even more susceptible to invasion of microorganisms, more likely to have an infection. And ulcers tend to be very resistant to healing. They're hard to heal. And that's because the reason they were caused is the lack of perfusion. And again, remember, we need perfusion. We need blood vessels to carry the oxygen and the nutrients to that tissue for it to heal and to take out any infection that is there. So ulcers have a very big risk for complications. Dehiscence and evisceration, like I talked about already, just want to really break it down for you here. I thought this was a cute little illustration with the dehiscence showing the surgical wound popping open and the evisceration showing the intestines piling out. So again, dehiscence, a problem of scar formation, of deficient scar formation, so the wound isn't healing up, and any kind of pressure from pus or coughing or bearing down has caused this incision to pop open. Dehiscence in the early healing period typically happens because there's an infection or there's some sort of mechanical stress, coughing, that kind of thing. Dehiscence in the later recovery period usually happens when there is a poor development of that extracellular matrix and or there's ineffective or inadequate formation of the collagen, like we talked about in the earlier presentations. And again, evisceration is where we have the separation of the surgical wound that allows internal organs to actually come out, like the intestines. Super serious, can really be life-threatening. Keloids and adhesions are other complications that can happen. Keloids are hypertrophic areas that are like a scar. You see that here in the first circle. And this happens because there's too much collagen being produced at that site. We do see this more often happening in people that have deeply pigmented skin or darker skin, and it also tends to run in families. It is a result of ineffective healing, and unfortunately, when we try to take these scars off, it just causes another injury, so it causes more keloids to form. So take them off doesn't work. Adhesions are another problem of collagen deposition. So the collagen fibers that develop, and they can actually, as part of that process gone awry, they can form adhesions with injuries that are located in or nearby serous or watery body cavities like the peritoneum. So what's an adhesion? This means, like, if I have an injury and I have some sort of tissue that's healing inside my abdominal cavity. Maybe I had a C-section or something like that, and they cut open my muscle to take out my baby. If an adhesion forms inside of me like that, it means that my intestines can now stick to wherever that surgery was. So it can cause some problems, and it can just be there. Yeah, so basically what's happening there is that we have excess collagen fibers that are forming and connecting the two organs together. So it can like connect the bowel and the bladder and the ovaries to the peritoneum. And what that will do is restrict free movement, which can actually be a problem, and it may cause pain and loss of function. Chronic inflammation is another issue that can cause problems with wound healing. This can cause persistent or recurrent states of inflammation. Chronic lasts several weeks or longer, and that happens when that acute inflammatory or the immune responses were not successful. They didn't shut off the way that they should. That can be due to a pretty bad injury that just won't heal. It can be a persistent infection that we're not able to get under control, or maybe they have an autoimmune condition. Autoimmunity happens when the immune system identifies itself or its normal cells as foreign and attacks them. So many times these injuries or infections cause kind of chronic inflammation, and they make the injuries and the wound very slow healing. The cells of chronic inflammation, remember, in acute inflammation, cellular activity, the whole goal there is to quickly respond to the injury and trigger that whole healing process. Well, in chronic inflammation, we have this kind of ongoing activity of monocytes and macrophages and lymphocytes of the immune system that just lasts a really long time and is more prominent. And in chronic inflammation, we end up having macrophages, proteinases, and fibroblasts that all work together to create scarred tissue. So monocytes circulate in the blood as they should, and there, when we have an injury, again, we have that dilation of the blood vessels, we have the permeability of the blood vessels. The monocytes, first the neutrophils get to the site, then they start to mature into monocytes. Well, once the monocytes move to a specific tissue, they're going to mature into the specific type of macrophage that the body needs to get rid of that particular debris or the infectious agent that is there. So when the monocyte matures into a macrophage, they're going to make proteinases and fibroblasts. Proteinases are enzymes that destroy and break down elastin and tissue components. Their whole job is to break down dead tissue, but they don't know how to tell the difference between dead tissue and tissue that shouldn't be broken down. So when we have something that happens that is making that proteinase activity too long and it's ongoing, like in chronic inflammation, it's actually going to break down tissue, not just at the site of injury, but around the site of injury as well. And this is where we see, like in a pressure ulcer, you see the injury being where the ischemia happened, but you see a whole area of that tissue just starting to break down. Fibroblasts are also active in chronic inflammation, and they are responsible for the development of collagen, which contributes to the extensive scarring that we see in people that have chronic inflammation. And that scarring is going to lead to permanent loss of function and can even lead to deformity of the tissue or the organ. Granuloma formation is also a possible complication of chronic inflammation. These tend to occur in specific tissues, and they tend to form when the injury is just too difficult to control by the typical inflammatory and immune mechanisms, usually because there's some sort of foreign body or microorganism at the site. And they get formed by macrophages, and the whole job of forming these granulomas is to actually protect all the healthy tissue around that from being damaged. So these macrophages adapt into what's known as giant cells or epithelioid cells. And these giant cells are these phagocytes that are able to engulf large particles. Epithelioid cells gather and contain smaller substances, and they are going to form a wall or a fibrotic granuloma around the affected area. So inside of that wall, the macrophages break down the harmful substance, whether it's a microorganism or whatever, and as a result, necrosis fills the inside of this granuloma, and it gradually diffuses through the cell wall, so it leaves behind kind of a scarred, empty capsule. One of the main conditions that we see this in, and yes, I'm going to test you on it, is Mycobacterium tuberculosis, or TB. In TB infection, which is a very long-lasting infection, once the infection itself is over, they end up with caseous necrosis. You remember that from Module 1. And this is where they have a pocket of scar tissue that can't adequately move oxygen anymore. So it's basically just an empty little case that can't do any job that the lung needs to do. What do we see in patients that have chronic inflammation? We're going to see the same kind of things that we would see in acute inflammation, the redness, the heat, the pain, the swelling, the loss of function, but they may also have things like fever, malaise, which is just a fancy word of saying they just feel icky, right? They don't feel good. They might have anemia. They might have fatigue or anorexia. And here when we say anorexia, I'm not talking anorexia nervosa. I'm talking about not being able to eat. Maybe they don't have an appetite. They're just not eating enough, and they're losing weight and becoming very weak. Remission of chronic inflammation can sometimes occur in some conditions. So patients may not have symptoms of their chronic inflammation during these periods where it kind of goes away. That's remission. Chronic inflammation can occur because there's any type of injury in the body, even including genetic anomalies like the mutations we talked about in Module 1, could be due to an autoimmune problem or an allergic response. So when we treat chronic inflammation, the best way to treat it is to remove the cause. We can use some medications, but again, we talked about anti-inflammatory medications that impact that COX or COX pathway 1 or 2, and we also talked about things like glucocorticoids or steroids, and they all have downsides. So you really can't use them long term, right? So if we use long-term anti-inflammatories or immune modulating medications, it can end up causing a decrease in the immune system. It can end up causing a breakdown of our stomach lining. So we have to really weigh the risks and the benefits. Heat and cold are used to reduce inflammation. When it's like a joint or a muscle, we can immobilize it to prevent continuous inflammation at that site of a joint or a bone or a muscle. We can put the patient on an anti-inflammatory diet, make sure they're eating lots of fruits and vegetables and salmon and fatty fish and that kind of good stuff. We want to promote movement to get the blood flowing, so they may need some physical therapy, but they're also going to need that balanced with rest. And there are some homeopathic treatments too, like acupuncture or even guided imagery that can be used, because we do tend to see chronic inflammation in people that are stressed out a lot. So that's it for this presentation, and you'll move on.